Take a moment to think about the following question. Have you heard of gender dysphoria or body dysmorphia? If so, what do you know about them? Do you experience them, or do you know somebody that does? Pause the video and discuss. Gender dysphoria is defined as a marked incongruence between their experienced or expressed gender and the one they were assigned at birth. People with gender dysphoria often don't feel a real connection to the societal norms of gender binary, male or female. Those that do identify with one or the other when experiencing gender dysphoria often feel more of a connection to the opposite binary as the one they were born as or their assigned gender. This can result in tension within relationships with family, friends, and often oneself. People with higher levels of gender dysphoria may experience symptoms of depression and anxiety, substance abuse disorders, a negative sense of well-being and poor self-esteem, and an increased risk of self-harm and suicidality. Gender is not a male-female split as previously thought. Instead, it's a spectrum, from cisgender, identifying as your gender assigned at birth, to transgender. A person's sex and gender are two separate things entirely. Your sex is what you have biologically, your gender is what you identify as. Young boys are not expected to be effeminate, and young girls are expected to be nurturing, warm, and sensitive. These behaviors are also congruent with cultural norms. Children usually start identifying gender between ages 3 to 5. Body dysmorphia is an intense feeling of dissatisfaction or being upset with your body and/or appearance. More extreme than simple vanity, dysmorphia often gets in the way of one's ability to function normally, and worrying over your appearance may become overwhelming. You may find that negative thoughts about you and your body are hard to control. You may even spend hours each day worrying about how you look. Your thinking can become so negative and persistent you may think about suicide at times. You can become obsessed with any part of your body. The most common areas are your face, hair, skin, chest, and stomach. Body dysmorphia can be caused by many different environmental, psychological, and biological factors. More often in teens, it can be caused by feelings of inadequacy and fear because of teasing and bullying. Dysmorphia is often seen through repeated symptoms such as excessive grooming or exercising, repeatedly asking if you look okay, avoiding social activities because of your appearance, constantly comparing yourself to others, and many more. Some people experiencing dysmorphia even report anxiety, depression, and suicidal thoughts. Once cleared of any other mental health disorders that could be the cause of your symptoms, you might receive a dysmorphia diagnosis based on some of these symptoms. Not a lot of research has been conducted on adolescents with onset gender dysphoria, so not a lot is truly known about how it affects the teen community or their development. According to the National Institute of Health, consolidation of identity development is a central developmental goal of adolescence, but we still do not know enough about how gender identity and gender variance actually evolve. Somebody's identity is how they understand and describe themselves to both themselves and the outside world. Your identity includes many things about yourself, not only your gender, but also your nationality, the language you speak, your relationships, what you believe in, and everything else that makes you, you. Parts of your identity will change over time, mostly during adolescence, including, in some cases, your gender. When interviewed, teens with gender dysphoria mentioned their social environments, bodily changes, and romantic or sexual experiences to all be central factors in how their dysphoria was affected within their community. Pause the video again. Take a moment to think. What parts of your identity are most important to you? If you think you've experienced body dysmorphia, you should consult with your doctor. They'll likely ask you some questions about how your daily life has been affected by your altered perception of yourself. From there, they may refer you to a mental health specialist. If your symptoms are mild, you might be referred to a type of talking therapy called cognitive behavioral therapy. It helps you learn what triggers your symptoms and teaches you different ways of thinking about and dealing with your habits. You and your therapist will agree on goals for the therapy and work together to try to reach them. Your therapist will help you find other ways of dealing with your feelings in these situations so that over time, you'll be able to deal with them without feeling self-conscious or afraid. For moderate symptoms, you could be offered either cognitive behavior therapy or a type of antidepressant medicine called a selective serotonin reuptake inhibitor, or an SSRI. It may take up to 12 weeks for SSRIs to have an effect on your dysmorphia symptoms. If they work for you, you may be asked to keep taking them for several months to improve your symptoms further and stop them from returning. It's important to tell your doctor if you're feeling anxious or emotional or are having thoughts about harming yourself while on SSRIs. If you haven't had symptoms for 6 to 12 months, you'll probably be taken off of them. This will be done slowly by reducing your dose over time to help make sure your symptoms do not come back, which is known as relapse, and to avoid any side effects of coming off the drug, known as withdrawal. Pause the video one more time. An easy way to help combat dysphoria is to remind yourself of something good about you. Take a moment to reflect. What is one thing you like about yourself and why? When you have your answer, come up and write it on the board, then discuss with your peers. Treatment for gender dysphoria can include changes in gender expression, hormone therapy, surgery, and supportive behavioral therapy. It is important to find a healthcare professional who has expertise in the care of gender diverse people so that you are well supported during treatments. Gender expression involves how gender is shown to the world through a way the person looks or acts. It may include changing one's clothing, mannerisms, and communication style, among other things that are more consistent with a person's gender identity. Gender-affirming surgery involves procedures that make changes to the chest, genitals, or facial features that help a person's appearance align with their identity. Hormonal treatments involve injections of male and female sex hormones, such as testosterone or estrogen, to boost the levels of that hormone in a person's body, drawing out more features common to that sex. If you can't afford or don't want surgery or hormonal treatments, you can try other options, such as breast padding or binding, genital padding or tucking, or using makeup. There are a lot more ways to alleviate symptoms of dysphoria, and most surround having an open, supportive community. Even just using somebody's preferred name and pronouns can help them immensely to feel more comfortable. Social support from family, friends, and other loved ones in communities may help prevent depression, suicidal thoughts, suicide attempts, and anxieties regarding dysphoria. You might be referred to a type of talking therapy called cognitive. Whoa. Gender-affirming surgery involves procedures that make changes to the chest, If you can't afford or don't want surgery or hormonal treatments, you can try other ointments. Ointments? What is an ointment?